your connection in Southern Oregon and Northern California. This is News 10 at 5.
Good evening, I'm Rick Tillery.
I'm Trish Close. Thanks for joining us tonight. This year's flu season picking up steam.
It hasn't hit our area hard yet, but it might be just a matter of time. That's tonight's top story at 5.
Traditionally, it's late January, February into March.
But nationwide for 2013, it might be a little different.
It looks as if it's not really hit fully locally. We're getting some flu cases.
Jim Shames works for the health departments in both Jackson and Jospehine counties. He says so far, this area has been spared.
If you look at the nation, you'll see that the South has been very impacted, and the Northeast and the North Central is getting, is beginning to get greatly impacted, and the West is just now coming on.
And it could come fast.
So I would guess within the next week or so, we're going to see a significant increase in flu cases.
Tracking the flu's progression can at times be difficult.
It's a little hard to know exactly what our data is here in Jackson and Jospehine counties. Statewide, they're still calling this sort of a mild to moderate increase in flu cases.
That's why medical professionals recommend getting a flu shot.
Everybody over the age of 6 months should get a flu shot. There are certain people that are at risk of getting more serious illness, and that would be pregnant women, people with chronic diseases like asthma, heart disease, the very old.
Shames also says anyone who comes in contact with the high-risk groups should get the flu shot, especially healthcare workers and their families. But just because you get the shot does not mean that you are guaranteed to not get the flu.
It doesn't mean that. It's an imperfect protection.
The Jackson County Health Center sees about 15 people a day getting the flu shot. So what do you think about getting the flu shot? Do you think it works? Like News 10 on Facebook and let us know.